So the lateral center edge angle is an indicator of the coverage of the femoral head by the acetabulum. And we know that this should be around 25 to 40 degrees. So to measure this, what we do, this is a video of us measuring this in Intel Viewer. You want first a circle of best fit around the femoral head. And this is predominantly just to give you a dot in the center of the femoral head, which is going to be a reference point that you'll see in a second. And then what we'll use is an orthogonal measurement. And so you'll see me select this now from Intel Viewer. And we want a transverse reference line. There's a couple of different places you can draw this, but I'm going to draw this from the teardrops of the pelvis. That's the top of the obturator frame in there. You've got that white dense area we call the teardrops. And you want a line between those two, which basically gives you an indication of if there's any inclination or lateral kind of bend or flexion of the pelvis there. And the orthogonal measurements gives you a second line that's automatically perpendicular to that. Now we want a line that is consistently parallel with that relatively vertical line. And then that second line is going to be manipulated in a second. But we're going to place this here anchored in the center of the femoral head. And then we're going to move that second line to the most lateral aspect of what we call the sourcile. Sourcile is French for eyebrow. It's that white zone at the top of the acetabulum there. And it represents the area of weight bearing in the acetabulum. So it's not necessarily the most lateral aspect of the acetabulum. It is the edge of the sourcile is where this is measured. And again, that's one of the things that can differ a little bit internationally, but that would be certainly the consensus here in Melbourne in Australia. So just to orientate, the reason for that first transverse reference line is to take into account any obliquity in the pelvis, because that would transfer to that vertical line, and that's where you should be measuring the angle from. And so that angle, as we said, should be between 25 to 40 degrees. Anything more than 40 degrees and you'd be suspecting more pincer impingement or over coverage of the acetabulum. Anything less than 25 degrees, here we would consider hip dysplasia. There are some centers that will consider borderline hip dysplasia as 20 to 25 degrees. And then anything less than 20 degrees is hip dysplasia. Some other places would consider 18 degrees as the cutoff, but we generally work with this binary. Less than 25 degrees is hip dysplasia, more than 25 degrees. Between 25 to 40 degrees is normal.
I think you make a good point about that lateral sourcile line, because a lot of people think it's just the edge of that acetabulum. And we know that on a lot of these x-rays, individuals would have developed osteophytes or even cystic changes around that. And although that might be the edge of the acetabulum, you'll see it's not the edge of the weight-bearing zone. And so that can drastically change the lateral centre edge angle if you're going right to the end of some osteophyte as opposed to the weight-bearing zone.
Absolutely. Can make a big difference in the numbers, can't it?